the number of measles cases since April has kept on increasing until to date. Somalia and Somaliland are right now facing the largest outbreak in the world. We're seeing the number of cases just kept on increasing from 2 to 3 patients per day to, I remember last week the nurse telling me they've received 18 patients. These are areas that are affected by conflict. Right now, everyone knows what's going on in the Horn of Africa with the drought and the associated mass population displacements. We are having fragile and weak healthcare systems. So all this compounded with the measles situation is just making the whole situation worse. There is a baseline low vaccination coverage in Somalia and Somaliland. For instance, the data that we have puts the under 2, for example, I was talking to a colleague, and saying the under 2 coverage had gone down to as low as almost less than 15%. Measles itself is it's caused by a virus, and with measles, it basically weakens the immune system, making it more prone to getting other infections. So right now, what we're doing as MSF, one, of course, first and foremost, with the sick children, we're doing case management. That entails hospitalization, and those also in outpatient, and also together with the Ministry of Health in both South Sudan and Somaliland, we are planning on conducting vaccination campaigns in the most affected areas. It's going to be a toll because the populations are dispersed, so there's a lot of logistic implications involved. Teams have to really go down from house to house, and some of these houses are really are far from each other, and then most of these populations have moved, so they're not in one place. But here we are doing the best we can together with the Ministry of Health to plan the micro-plan the best so that we ensure that at least we get over 90% coverage to be able to control the outbreak. We're dealing with measles at the moment, but what we have seen over the last 2 years, especially in regions like where we are in Somalia and Somaliland and also South Sudan, note the impact that COVID had on the routine vaccination activities. It's not only measles vaccination that are affected. There are also other vaccine-preventable diseases that were affected. So we're asking ourselves the question, we're seeing measles now. Are we going to see a resurgence in another vaccine-preventable disease coming up?